Mr. President, just over a year ago in this chamber, three brave Republican colleagues, Senator John McCain, Senator Susan Collins, and Senator Lisa Murkowski, joined all Democrats in voting against health care repeal legislation. They listened to the families of their states. I, too, voted against that repeal legislation because the people of Wisconsin did not send me to Washington to take away their health care. When congressional Republicans tried to pass repeal plans that would allow insurance companies to charge more for pre-existing conditions, families across our country fought back. When the Republican majority tried to charge older Americans an age tax and make people pay more for less care, people let their voices be heard and sent a loud message to Washington: protect our care. They sent us all a clear message that they want us to work across party lines to protect the health care guarantees they depend on and to stand up for those with pre-existing health conditions. But defeating the legislative efforts that would have made things worse for families did not end the threat to the American people. The Trump administration has been trying to do what congressional Republicans couldn't. They have been sabotaging our health care system and rewriting the rules on guaranteed health protections and access to affordable care that millions of Americans have today. This sabotage has created instability in the health care market, contributing to widespread premium spikes in 2018. This administration ended the critical cost-sharing reduction payments that made health care more affordable for almost 90,000 Wisconsinites. The Trump administration again slashed funding for outreach efforts to help people sign up for health care. Trusted navigator programs like those in Wisconsin have had their funding cut by nearly 90% in the past 2 years. This will mean fewer people in rural Wisconsin will receive the support they need to obtain affordable coverage this year. But it doesn't stop there, Mr. President. The Trump administration has even joined Wisconsin governor and Wisconsin's attorney general and other states in going to court to support a lawsuit that would take away guaranteed protections for people with pre-existing conditions. If they succeed, insurance companies will again be able to deny coverage or charge higher premiums for the more than 130 million Americans with a pre-existing health condition. In fact, the Affordable Care Act's protections for people with pre-existing conditions, if they're struck down in court, Wisconsin is among the states that has the most to lose. According to the Kaiser Family Foundation, 1 out of every 4 Wisconsinites has some sort of pre-existing health condition, and they simply cannot afford to have the health care that they depend on threatened with higher costs or coverage denials. Now, the Trump administration has expanded junk insurance plans. These plans are cheap for a reason. They do not have to provide essential health benefits like hospitalization, prescription drugs, and maternity care. And according to the fine print of one of the plans sold in several states, including my home state of Wisconsin, marketed by Golden Rule Company, the plan doesn't even have to cover hospital care on a Friday or Saturday. So it'll be just your bad luck if you happen to get sick and need health care on the weekend. And the very first exclusion states that it provides no benefits for a pre-existing health condition. The fine print also notes that if you're pregnant, that will be considered a pre-existing health condition. These junk insurance plans can deny health care coverage to people with pre-existing conditions when they need it the most. And that's why I'm leading this effort in the United States Senate to take action and stop this sabotage. Mr. President, this is personal to me. When I was 9 years old, I got sick. I was really sick. I was in the hospital for 3 months. I eventually recovered. But when it came to health insurance, it was like I had some sort of scarlet letter. My grandparents who raised me couldn't find a policy at any price that would cover me, not from any insurer. All because I was a child who had been branded with those words, pre-existing condition. This is also personal for Chelsea from Wisconsin. She lives in Seymour, and she has her family there, and her daughter Zoe was born with a congenital heart defect. Right now, Zoe is guaranteed access to coverage without being denied or charged more because of her pre-existing condition. Chelsea wrote me during that debate last year, "I'm pleading with you as a mother to fight for the kids in Wisconsin with pre-existing conditions that are counting on you to protect that right. No parent or grandparent should have to lay awake at night wondering if the health care that they have today for themselves and their families will be there tomorrow. But with the expansion of these junk plans, that fear could become a new reality for far too many families, as healthy people leave the market, increasing premiums for everyone. Children like Zoe may not be able to find any plan that her parents could afford or that will cover the care she needs. No family should be forced to choose between helping a loved one get better or going bankrupt. But before the Affordable Care Act, too many families had to make that choice. Before the health law, I heard from Sue from Beloit, Wisconsin. Sue's husband was diagnosed with lung cancer, and they quickly found out that their insurance plan had a $13,000 limit on radiation and chemotherapy. Well, that covered about one round of chemotherapy. When they needed to continue treatment, Sue and her family used all of their savings, and then they maxed out all of their credit cards. And when they were facing insurmountable credit card debt, she told me, I had no choice but to file for bankruptcy. Sue's husband later died. Mr. President, we can't go back to the days when insurance companies wrote the rules, just as we cannot allow the Trump administration to rewrite the rules on guaranteed health care protections that millions of Americans depend on. More than 20 of the leading healthcare organizations in America, representing our nation's physicians, patients, medical students, and other health experts, are supporting this resolution to overturn the Trump administration's expansion of junk insurance plans. They're doing so because these junk plans will reduce access to quality coverage for millions and increase costs. These junk plans will charge people more for coverage based on their pre-existing conditions or deny them coverage outright. These junk plans will leave cancer patients and survivors with higher premiums and fewer insurance options. And these junk plans will force premium increases on older Americans. I've heard my colleagues on the other side of the aisle say that they are committed to protecting people with pre-existing conditions. Now is your chance to prove it. Anyone who says they support coverage for people with pre-existing conditions should support this resolution and overturn the Trump administration's expansion of these junk insurance plans. This is an opportunity for Democrats and Republicans to come together to protect people's access to quality, affordable health care when they need it the most. Let us join in seizing the opportunity to do what's right by the American people. Mr. President, I yield.